Hello. As you know, I'm doing a countdown to 1000, and as of today, I'm at 137 to go. Right, anyway, run the intro. Hello, my name's Andy. I'm the Ginger Pond Keeper. Welcome to episode 110. Right, so this is going to be a little bit of a different episode. I'm not just doing a voiceover. I'm going to talk to camera, which I do from time to time if you're new. And I haven't really prepared a script. I've got a few notes, and hopefully they'll keep me reasonably on track. But it's about a subject that I thought about quite a lot, and it's come up in quite a few live shows of various channels, and also a lot of individuals' channels and a lot of discussion in real life and on the internet. And it's something I wanted to, chuck my thoughts into the ring, as it were, as well. So it's about fish health, as the title of this video would suggest. But it's not going to be a how-to video. It's not going to be an instructional video. I'm not going to be talking about if your fish has this condition, then treat with this. It's not what I'm going to be talking about. I think what it's really going to be about is about the central issue, I think anyway, which makes it so much harder for us. And it's not really about fish as such, although obviously them being fish is central. That doesn't make sense. It will make sense soon, I promise. Right, the other thing I want to say is I'm by no means an expert in this area. I've been very fortunate. I've had a pond for 9 years, but I think because of the particular carp and fish that I keep in my pond, I've been very lucky and I've not had a lot of fish health issues to address. I had some tench that had fin rot. That cleared up with one treatment, so that's good. And the carp have had parasites twice, so over 2 years. So in 1 year, again, it was one dose and it cleared up. The next year was quite different. I had to give them lots of doses before it eventually cleared up. And I won't go into the specifics of that. There's a video that you can see up there, which should explain what happened that year. But it's easier for me than it is for a lot of koi keepers, let's be honest. I've got carp and they're very similar physiologically, but I see lots of koi carp when they have even just flukes, so not some costia or some parasites like that, which can make them particularly ill, or bacterial infections, get really ill. My fish had flukes, and you couldn't tell, apart from the fact they'd flash on the bottom of the pond or they'd jump, you couldn't have told that they were ill or were suffering with anything. They were more like when cats had a couple of fleas, They were just irritated by them, but they were active as normal, they ate as normal, there were no real problems. So that gave me advantage in making some very sort of considered decisions, really, and not worrying too much about the fact I wasn't clearing up the flukes. So I realised I was in somewhat of a luckier position than lots of koi keepers find themselves in, for instance. But it's still a very similar situation to the central issue I'm going to talk about. So I'm not really an expert, but I do bring some relevant knowledge to this, and I bring it in from two sources, really. One, I've been part of a household that's had lots of other pets and owned lots of other pets directly myself. So dogs and cats and guinea pigs and gerbils and all those sorts of pets. Where managing health conditions is a lot simpler. And also, I'm a human being. So I've had my own health issues treated and my children's health issues treated. And in addition to all of that, I'm also a nurse, and I have been for 33 years. And now I'm not a nurse that works in a hospital. I work in a different branch of nursing, but obviously things around health treatment, best practice, medication, that sort of thing has been quite central to my work for over 3 decades. So I think I bring something relevant to the discussion. Right, so talking about the differences in how fish health is managed. So if one of your children, if you're a parent, or one of your pets is poorly, you do a very similar thing. You take them to the GP or the vets. Hopefully you get that the right way around and you don't take your child to the vet. But you take your pet or you go to see a doctor and they do a very similar thing. They'll ask some questions, they maybe do some tests, they do an examination, and the doctor or vet will come up with a diagnosis. They'll then talk about treatment options, they'll decide on a treatment, sometimes sort of with you, but they'll bring the options to you. And then they'll decide on a starting dose, and then they'll either administer that treatment or they'll give it to you to administer, or the patient, or whatever. And they'll give you some advice on what to look out for, and they'll also give you advice on when to return to them if you need to. Now, that would be broadly what you do if you had a cat. We had a couple of cats that had, especially as they got older, quite a lot of health issues, and that's broadly speaking what happened. Now, for fish, it's very different. So if you've got a fish, you decide they're unwell, you do the diagnosing, you might do a scrape to find out what parasite they've got, and then you decide upon a treatment. You purchase that treatment or source that treatment. You also decide on a dose. You also work out what you've got to look out for, and then you decide what you've got to do depending on how well that treatment works. So you're doing it pretty much all yourself. You might get advice from the internet, but very rarely, unless you're very lucky, does a trained medical professional relevant to the species of animal you're looking after advise or prescribe or do anything like that. And that's a real problem for a number of reasons. And it has kind of big consequences that is really central to some of the decision making that's taken when decided upon treatment and dosages for fish. So fish are kind of complex in that they live in water. So water complicates things quite a lot. So it complicates things on the basis of chemistry and biology in terms of how fish get ill, being prone to being unwell, what kind of infections they get. And it also complicates things on a practical level. How would you get a fish to a medical professional or the medical professional to your fish? And it may complicate treatment as well in various ways. But I don't think any of those issues are insurmountable. Sometimes human treatment for conditions can be very complex. So, for instance, a doctor may decide on a dosage or a treatment based on the sex of the individual, the age of the individual, the weight of the individual, the lifestyle of the individual, the other health conditions that individual might have, and other medications that individual might have. But a doctor would be able to do that. And the reason that doctor is able to do that is there'll be a ton of evidence-based practice guiding them in choosing a treatment and in choosing the dosage for that treatment. And by and large, that isn't there for fish. Or if it is, we don't have ready access to people who know that information, share that information, or as lay people know what to do with that information. So again, that all makes it very complicated. And that's because we can't really get our fish to vets, and that's because to a great degree, vets don't really support the health of fish in the same way they do for dogs and cats and hamsters and guinea pigs and those sort of animals, or even farm animals. There doesn't seem to be the knowledge base and the systems and processes in place to support fish health. Now, you may be lucky in that your local vet has a special interest, so can support you with the health of your fish, or you might have a fish vet round the corner from you. I think about 30 miles away from where I live, there is a fish vet. But by and large, not every vet will do that in the same way that they'll support the health of dogs and cats, as I've said. So, as fish keepers, if we're looking for treatments for a condition, we basically only have access to what's termed over-the-counter medicine. So to give a little background to that, over-the-counter medicine is the sort of medicine that you or I could walk into a shop, say a supermarket or even a chemist, and just buy over the shelf. You might need to answer some questions, but by and large, you can just buy that medication over the shelf. It's not medication that has to be prescribed by a doctor. And generally it's because that's of a lower strength or indeed a lower risk, and the advisory dosages are lower than they would be if a doctor was prescribing it. So the next type of medicine is medicine that a doctor would prescribe, and that may require more guidance, more knowledge behind its usage, and maybe a greater risk as well to some degree. And you can only access that medicine from a doctor. And then there's other medicine that you might need to be in a hospital situation with immediate medical professionals around you to be prescribed it. And we, as fish keepers, can only really access over-the-counter medicine. So all of the medicine we can buy in our local shop or buy online, so whether it's Fluke M, I think is one type of anti-fluke medication, or general anti-parasite medication, or indeed potassium permanganate, PP, is over-the-counter medication. And I do hear a lot when people are talking on live shows or in their own videos, or in the comment section, that the dosages for a lot of those medicines are quite low. But actually there is a reason for that. And the reason for that is they're very much, as I've said, in the over-the-counter bracket. So they're medicines that are being used and managed and chosen by lay people. Now, you may be a very experienced layperson with decades and decades of experience of looking after fish, but in terms of medication, you're a layperson. So all of the guidance for that medication, for it to be able to be manufactured and sold and accessible to you, the guidance needs to be in a low risk bracket. So let's use PP as an example. So I think the guidance on PP is you add 2 grams per 1,000 litres of water. And I hear many people say that that's quite a low dose, and they use a much higher dose. Now, I don't dispute that, and they say it's safe to use in higher dosages. And again, I don't dispute that either. But the manufacturers of PP, when they recommend that dosage, they're not, because again, I don't know if people mean it in a critical way. They say they're playing safe, and to a degree they are, but actually what they're being is responsible, because they don't know who's buying that treatment. They don't know the state of the pond, they don't know the state of the fish, they don't know the skills of the person, so they have to give a responsible dose. And so the dose they advise to give for this over-the-counter medicine is a dose that might work, has a good chance of working, and people will say they use it as advised on the packet and it does work, but has a very low risk of causing any adverse effects, including the fish dying. So it's a kind of, in a sense, just wait for that car to pass, it's in a sense, you've got to consider it in terms of risk benefit. So it's likely to work, it has a good chance of working, but has a low chance of causing any adverse effects, including the death of some of the fish it's attempting to treat. And that is responsible guidance by that manufacturer. It's not really them playing safe or covering their back, it's responsible, because they have no idea who's buying that product. So I'd like to talk a little bit about medicines in general and risk of adverse effects, and I'm going to generalize heavily, so anyone with any more medical knowledge will probably be able to pick holes in what I'm about to say, but it's kind of relevant, and it's a generalization. Not all medicines fit this, but most do. So if we're talking about what causes a risk of an adverse effect, then the risk of an adverse effect goes up as the dosage of the medicine goes up. So the higher the dose, the higher the likelihood of an adverse effect. Now, that doesn't mean the adverse effect is definitely going to happen, just that the risk of the adverse effect is higher. Now, the other thing that will raise the risk of an adverse effect is the length of time of exposure to that treatment. So the longer the patient, whether that's a fish or a person, is exposed to that treatment at that dose, the greater the risk of an adverse effect. And the final thing that will raise the risk of an adverse effect is how unwell the patient is. Now, not necessarily that they're more likely to have the adverse effect, but their ability to cope with the adverse effect will be reduced. So, for instance, if a fish has been really unwell with a parasite, it's been off its food for weeks, has been really lethargic, and then you gave it quite a high dose of a medicine, the chance of an adverse effect may be the same, but the chance of that adverse effect killing the fish is probably higher. So when we talk about the likely risk of an adverse effect going up with a high dose, we don't mean that it's definitely going to happen, but that it's more likely. But what we don't know in terms of fish, and again using PP as an example, is why some people can use a dose that's 10 times the advised dose on the packet and their fish are fine, and some people can use the advised dose or maybe twice the advised dose and lose fish. Because it doesn't really, well, it does make sense. And I'm sure we could all guess at reasons why. We could guess at maybe the organic load in the pond. We could guess at the health of the fish at the time PP is being given. We could guess at the skills of the person using it to spot problems earlier. We could talk about the water quality. We could talk about the turnover of water. We could talk about the oxygen level in the pond. There's lots of things we could guess at, but we don't know. So we don't know, in the same way I spoke earlier about doctors knowing what dose to give for an adult male would be different to an infant girl. We know that both on educated guessing, but also because there's a wealth of research that's been done and a wealth of gathering of evidence and empirical data to tell us that that is likely to be more risky at that dose for a 3-year-old girl than it would be for a 30-year-old man. But we don't have similar data for fish. So we don't know what are the criteria that make a 20 gram per 1,000 litre dose of PP safe in this case, but not in this case. We can guess, but we don't know. And because we don't know how to advise those intermediate doses. So you may not be able to give 20 grams per 1,000 litres, but you could give 10 grams. That would be safe for you and your pond and your particular circumstances. But we don't know. And the reason I think we don't know is because we haven't done the research, or the research hasn't been done. The manufacturers don't do the research because they know the dose they give is almost certainly likely to be safe and may well work. So it's a responsible bit of manufacturing, advising, and supply to fish keepers. But what it doesn't do, and it doesn't need to do as a manufacturer of PP and a supplier of PP, is to test any further than that. And to test why there's those discrepancies in the dose that some people can give and some people couldn't. One of the things, and I'll raise this as it's popped into my brain, is something I was thinking about the other day is when we give treatments, we base the amount of the treatment we give on the volume of water it's going in, which makes some sense because when you put, say PP again, into a pond, into the water, it becomes a solution. It mixes with the water and it's then a solution of that treatment in your pond. And the fish swim around in the water, absorbing that treatment through their skin, through their gills, through their mouth, I think probably through their eyes a little bit as well, and they absorb that treatment. But something that crossed my mind the other day, if say you're putting in 2 grams per 1,000 litres into a 10,000 litre pond that has 2 fish in it, and you're putting the same dose in a 10,000 litre pond that has 20 fish in it, all of the same size, and then you leave it in for 10 hours. Let's be grammatical, do the 2 fish absorb more of that active ingredient of that treatment than the 20 fish do? I don't know. It seems likely they would, but the solution's the same strength, so maybe they wouldn't. But do the 20 fish absorb more of that treatment, so over that period of time it's in the pond, it becomes a weaker solution anyway? I don't know. Maybe other people do. You may well know the answer to that. I don't. There may have been some research already on that kind of thing. I know there was some good research. It was on the Gaz's Koi Pond live show. I think it was Crafty Koi who shared it. That there was some really good research that showed that if you leave your UV on, the potency of the active ingredient in the treatment is much, much lower. I can't remember what the treatment was, than if you turn your UV off. And that's really important information, and that's the sort of information we should know about lots of other factors, not just the UV, on lots of other treatments. That's exactly what we need to know. And the reason I don't mention what the treatment is one, I can't remember it, and two, it's not important. What's important is that is an example of research that we need more of, and we need wider research. So why isn't that research done? Because it's done for other animals. It's done for dogs and cats, broadly speaking. Why isn't it done for fish? And I think the reason it isn't done for fish is there is no widespread, responsible medical professional that prescribes treatments to fish in the same way there is for dogs and cats and there is for people. Because they're the people that would want that research done. They might conduct the research, they might push for the research to happen, they would contribute to the research. But you know, as we've said and as we know, most vets don't do the same amount of fish health support as they do for cats and dogs. My local vet doesn't. They're great with my cats. As I said, we previously had cats that had lots of health conditions and they were fabulous with them. But they wouldn't support the health of fish in the same way. If they did, and if it was part of their work, then they would want all that research done because they'd want to understand what criteria they had to consider when advising a dose to treat a certain condition. And if they were responsible for that and that was part of their work, then that research would be more likely to be done. But they don't. And I'm not critical of individual vets. I don't think it's individual vets' fault. I wouldn't criticise my veterinary surgery locally. I think they're great. I think it's the responsibility of veterinary bodies that structure the processes and the way the vets work. They should appreciate that fish are just as precious to fish owners as cats and dogs are to their owners. They're in many ways just as expensive as well. I mean, the recent carp that I've bought, and my carp are much cheaper for the size than koi are, but my recent carp, for instance, cost more than the 2 cats we've got at the moment. So, you know, they're just as important. And when I recently, just over a year, sort of 16, 17 months ago, lost pretty much all my fish to an otter. And 2 of those fish, maybe 3, but certainly 2 of those fish were my favourite fish I've ever owned. And I was much more unhappy than lots of other animals I've lost in the past as a pet owner. And they cost me a lot of money. And so I think vets should be taking more of a lead on this, but I think that needs to come from the bodies that govern veterinary services. And I think if vets were expected to support the health of fish in the same way they're expected to support the health of cats and dogs, that we have the systems and processes in place and we have all the research so we understood all those differences and what the factors were that influenced how effective or how risky a particular treatment was, which I think is really, really, really important. And I think, you know, as fish keepers, if we're going to campaign or push or sign petitions or make a change in the way that fish health is supported, I think that's the route we need to go down. It's a slow route, it won't happen overnight, but it's a really important route. I've watched many videos where people complain about the difficulty in obtaining antibiotics for fish that need them. And I do have some sympathy for people in that case, but I also have a little bit of sympathy for vets as well. Basically, the use of antibiotics by doctors and by vets is quite controlled and is quite, I think inspected is probably the wrong word, but it is under the microscope because there is a real problem with the over-prescribing of antibiotics, the overuse of antibiotics, and the fact that if that happens, then they stop being effective and we get lots of resistant strains. And that could mean in the end that we don't have antibiotics to use, and that would be slightly nightmarish. So there is a lot of restrictions on that. Now, I've heard a couple of people say, well, I've had this advice from this specialist and they've written a letter and I've given it to my vet and my vet still won't prescribe the antibiotics. And I think they feel the vet's being a little bit awkward, and some vets will. But I'd like to put that into a little bit of context on why I get where the vet is coming from. So one of the health conditions that in my type of nursing that I've supported people with a lot and done a lot of work with is epilepsy. Which, if you don't know, is a very serious neurological condition. It's the most common serious neurological condition that people have, and it's a very complicated condition to treat with medicine. So what tends to happen if somebody has a seizure or more than one seizure is they'll be referred to a neurologist. The neurologist will maybe do some tests, they will maybe do some examinations, and they will decide upon a treatment. Now, if they prescribe that, if they ask a GP straight off, send a letter to the GP and say, can you prescribe this treatment? The GP will probably say no. And what they'll want the consultant to do is to prescribe that medicine for maybe a month, maybe even up to 3 months first, to see that there's no problems and it's settled down, and they want the consultant to take responsibility for monitoring that for the first 1 to 3 months. And then the consultant will write to the GP and the GP go, yeah, I'll carry on to prescribe that. And the reason that is, even though a consultant, a specialist, an expert has advised a particular medicine, as soon as the GP writes the prescription, and to make this relevant to fish, bring it back to that, as soon as a vet writes a prescription for an antibiotic, they are taking responsibility. It's their name on the prescription. Now, even though they may have taken the advice and been given the advice by a specialist, they're still taking responsibility. It's very much on their head, as much as it is on that specialist. So they may not feel comfortable, and GPs don't very often, and this is the case often with some kind of antipsychotic medication as well, is they want the specialist consultant psychiatrist, or in the case of epilepsy, the consultant neurologist, to take responsibility in the short term, and then they'll pick it up once everything appears stable and as problem-free as medicine can be. So I guess that's probably why vets are sometimes reluctant. Now, that doesn't help us to know that and to maybe understand vets a little bit more, but it's part of why I think the way veterinary services works needs to change. And veterinary services need to be more informed about fish health and more regularly part of managing fish health, because ultimately you still may get vets who say, well, actually no, that specialist you saw, they can prescribe it, but they still are more likely to take on that kind of prescribing if fish health is generally part of their remit more than it is now. And I think that's what we really need to push for, rather than looking at individual incidents of why haven't they prescribed this antibiotic. More, we want vets more involved with fish health. Fish are an increasingly popular pet. You may not like the word pet, depending on how committed you are to koi keeping, for instance, but they fall under pets really. And but they're becoming a greater percentage of the pet population. They're very expensive in many cases, and they're very beloved, and they're very important to people. And I think vets need to do more, but doing more needs to come from the top, from the systems, not by berating an individual vet. That's not that I'm suggesting anyone says they should do, but that's kind of where I come from really in this debate. So I've probably waffled quite a lot. I think I should have done a script and done my normal voiceover, because this is a relatively complex issue. But to recap, fish health is quite complicated because they live in water, both in terms of chemistry and biology, but also practically. And we're not, as fish keepers, very well served by veterinary services. So as a result, we have to buy over-the-counter medicine, which responsibly is only given out in quite small doses and is regulated. That's nobody's fault as such. The gap isn't in people not giving us bigger dosages, it's in the fact that we don't have medical professionals advising and prescribing. That's where the problem is, not in what the manufacturers of Fluchem or PP put on their packets. It's not their fault. It's the way the system works. And there's the lack of research in advising both us as fish keepers or fish breeders or as shopkeepers, but any of us looking after koi. There's a lack of research to fill those gaps in our understanding of when dosages are safe and when they're risky. And again, for me, it all comes back to the fact that we need fish health to be better managed by veterinary services. And to change that, we need to go to the guiding bodies of veterinary services. So, I think that's it. I think I've waffled enough. Thank you very, very much for watching. As you know, I'm doing a countdown to 1,000. And as you might have seen at the beginning, I'm 137 to go. Thank you to all new subscribers and subscribers who stayed with me. I really appreciate it. If you've liked this video, this is a discussion video. Please join in the comment section below. Please share it. Please talk about it. I'd be delighted with that. If you, as you say, if you've liked it, please like. And if you're not already subscribed, please consider subscribing. I really would appreciate it. As I say, I'm pushing for 1,000. My birthday's on the 8th of January. I'd like to hear it by then. That would be great. Anyway, long way ahead, but that's what I'm aiming for. Anyway, I'll stop waffling. Thanks a lot again for watching, and I'll see you next time.